Hello and greetings from the famous UST Hospital, where in the last episode, we were welcomed by our lovely doctors from the Benavides Cancer Institute, where they helped us run through the diagnostic process for head and neck cancer. We are grateful to be introduced to several facilities, such as the outpatient department, ear, neck, and throat clinics, and the boardroom, where doctors from different specialties come together to discuss numerous complex cases. Today, as we continue to celebrate the Head and Neck Cancer Awareness Month, we are going to look at several methods in treating the head and neck cancer here in the Benavides Center Institute. Again, my name is Chelsea Rushana, and this is another episode of Lifeline, the show where we improve our lives by feeding our minds. So after diagnosing and examining the case po, how do doctors usually determine what kind of treatment would be best for a patient?
Okay, so we need to look into all the different factors that will provide us information. We discuss it as a multidisciplinary team. So we look into the location of the primary tumor. Then we look at the histology. We sit down with our pathology colleagues. We look at the extent of the cancer or the resection. Sometimes we even go deeper to the molecular and genetic level. Then we make our decision. If it's primarily surgical or is it primarily a combination. Most often than not, the most treatment for head and neck cancers will involve surgery, but not all.
We're taking note of that po, Doc. And with that in mind, ano po bang mga available na services for the head and neck cancer treatments yung na-offer po dito sa UST Hospital?
Okay. So, of course, we have not only surgery, but also evaluation, diagnostic, and rehabilitation. As far as treatment is concerned, of course, we have our surgical unit can also offer reconstructive surgery here, aside from oncologic surgery. And, of course, the Benavides Cancer Institute for chemo and radiation and all those different modalities of treatment.
Thank you so much po, Doc. So, one of the most common ways in treating head and neck cancer is otolaryngology head and neck surgery. To find out more about this procedure, we are honored to sit down and join Doc Ian to help us more with these questions. So, going back to you, Doc Ian, what does the head and neck surgery do to treat head and neck cancer?
Okay. So, before you treat, you need to evaluate. So we're usually involved in screening patients, or better term is doing a thorough physical examination, endoscopy. So we need to look at the patient as a whole. Basically, we do the surgical resection, which could either be varied approaches. So it could be endoscopic, it could be minimally invasive, or the conventional open surgery, after which we also offer reconstructive surgery, usually with the use of pedicle flaps and microvascular or free tissue transfer.
Okay, so moving on, how much is the type and stage of the disease playing a factor in deciding if a surgery is the most effective treatment po?
Okay, good question, because not all head and neck cancer patients would require surgery. Although most of them are managed with surgery, not all will require surgical treatment. Okay. As far as the stages, the primary is decision making whether it's surgical or not is the type of cancer. So, like for example, we have lymphoma in the head and neck. These are primarily treated with chemotherapy. Okay? And while some viral-driven carcinomas like nasopharyngeal cancer and oropharyngeal carcinoma, especially those P16 positive, are primarily treated with non-surgical modalities, specifically radiation with or without chemotherapy. Okay. Now, in terms of the next decision making will be the stage. So again, those diseases or patients subsets that I previously mentioned would require non-surgical approach, but the rest will require surgery. So for early stage, of course, we can offer more or less less radical procedures. But for those advancing stage, usually the radical surgeries, which will also involve treating the neck, doing a neck dissection also.
Oh, I see. That's very interesting to hear naman pala, Doc. So, in line with that, meron po bang specific types of surgical treatment kayo na ginagawa when treating head and neck cancer?
It's basically wide resection.
Right.
Basically, if the goal is cure and you want to achieve this with surgery, the usual approach is always a wide surgical resection. Whether it's endoscopic or open, whether it's a primary tumor in the oral cavity or in the larynx. So we always do this with what we call yung frozen section, just to make sure that after the surgery, everything will be clean and negative for residual tumor. The key here is we cannot do it alone. So we have to do it together. Again, the deciding factor here is always the patient.
Yeah, that's great to hear po na talagang in everything that you do, talagang patients po yung center ng mga ginagawa ninyo. And that's something that we can really say that is caring dito sa may USTA. So, thank you po, Doc Ian, for answering our questions. I am here with Dr. Luisa Jacomina, and she will be showing us the process of making what is called a thermoplastic mask. So, Dr. Luisa, ano po ba yung thermoplastic mask and bakit po ba ito importante to make bago po makatanggap ng radiotherapy?
Yeah. So these head and neck cancer patients who will receive radiotherapy are receiving a kind of treatment that is personalized to them, and it's very exact to the kind of tumor that they have. So they have to wear something on an everyday basis that will keep them in the same position every time. They will typically receive treatment for about 6 weeks every day, and they have to maintain their position throughout the entire course of treatment so that we deliver a very personalized radiation therapy plan that is entirely customized, that will aim to spare them from a lot of the side effects of treatment while ensuring that we deliver very accurate and precise radiotherapy.
Okay, so given that po, since very customized po siya sa patients, could you tell us po paano po ba finifit and ginagawa yung mga masks na ganito?
Yeah, so the material is thermoplastic, which means when we melt it in a very high temperature water, it's malleable and it will conform to the shape of the patient. So when it lays over their head and their shoulders, usually there are points where we try to make it more fit, like the earlobes and then the nose bridge and then the chin, and those really maintain to keep their head in a proper position. So sometimes we also make sure that the mask will also get their mouth, because when the tumors are inside their mouth, we also need some more devices that will aim to expose the area that we're treating and keep them in a very reproducible position for the remainder of their treatment.
After the thermoplastic mask is made, the patient is ready to go through radiation therapy, which takes place in this room behind me. The patient is alone during the session while a team of radiation therapists operates in this control room. What is radiation therapy and how does it help treat head and neck cancer? How often and how many sessions does a patient have to undergo in treating head and neck cancer po ba?
Typical head and neck cancer patient will receive about 30 to 35 days of radiation that's given every single day from Monday through Friday for about 6 to 6.5 weeks. There are different cases wherein they may require a shorter number of treatments, and it really depends on a case-to-case basis. But the usual is about 6 weeks of radiation.
Okay po. And then could you also run us through the process of radiation therapy from the preparation to the treatment process? Paano po ba yun?
So first step is really to make the customized thermoplastic mask. And then behind the scenes, we work on their images to formulate a personalized treatment plan on how the radiation will be delivered on a daily basis. And then the patient usually comes back after a week after we have continued with the planning and the treatment computation behind the scenes. And then on a daily basis, the patient will undergo the treatment with our radiation therapists. They set up the patient on the table under the machine, and then we get images to make sure they're in the right position, and then we deliver the treatment. So it's the same 10 to 15 minute treatment on a daily basis, and they usually just monitor the patients throughout the treatment to make sure they're doing well.
Ngayon naman ay kasama po natin si Ms. Salazar, isa pong radiation therapy patient dito sa Benavides Cancer Institute. So, Ms. Salazar, magandang araw po. Gusto lang po namin matanong kung nakakailang radiation therapy sessions na po ba kayo at kumusta naman po yung experience nyo?
Pang-ilang ko na ba ito? Pang 30.
Nakarami na rin po pala.
Lagi na matapos. Ito, maraming side effect nung kasi sakit lamunan. Tapos nagsisingaw ako. Tapos lahat ng pagkain ko, walang lasa lahat.
Pero nakakatulong naman po ba siya sa recovery po ninyo?
Oo. Kasi dati, parada yung ilong ko eh. Hindi ako nakakahinga ng sa bibig ako humihinga. Ngayon, medyo maluwag na yung paghinga ko. Ang ko na lang ito yung masakit yung lalamunan, hindi ako makakain. Tapos, ito, yung mga may blister na ako sa leg. Ayun, tsaka, yung buho ko, nababawasan na rin dito sa likod. Yan, ko.
Sige po, maraming salamat po doon, Ms. Salazar, and wishing you a good recovery ahead.
Sana nga.
And that is radiation therapy. We thank our competent doctors for showing and explaining to us the treatment process. When we come back, we will be showing another way in treating head and neck cancer. So stay tuned only here on Lifeline. Hello and welcome back on Lifeline. Before the break, Dr. Jacomina showed how radiation therapy is done in treating head and neck cancer. But for now, we're moving on to another form of treatment, which is chemotherapy. But what exactly is chemotherapy? Well, fortunately, we have Dr. Arivan to give us all the answers about that. So, Dr. Arivan, thank you so much for joining us today. And pwede niyo po bang masagot, what is chemotherapy and paano po ba ito nakakatulong sa treatment ng head and neck cancer?
Chemotherapy is a type of cancer treatment that uses drugs to kill actively dividing cells. So it acts both on the cancer cells and in the normal cells. It is in the form of IV formulation, usually intravenous route. Now, in terms of head and neck malignancy, the use of chemotherapy is actually more of an adjunct. So, ibig sabihin, we potentiate the effect of the primary treatment, which is the radiation therapy. So, it acts both hand in hand in order to prolong or to act or to target the cancer cells in order to prolong survival of our patients.
Well, Doc, with that said, will you be able to show us how chemotherapy is done po?
Yes, upon talking with the patient, able to formulate our chemotherapy regimen, usually we advise them to have preset laboratories, usually 3 or 4 days prior to their scheduled chemotherapy. We assess their hemoglobin levels, their WBC, their recent creatinine and liver function tests. So prior to that, we ask them to have a specified schedule, and they are scheduled accordingly in the treatment unit, in the ambulatory treatment unit, which we will show later on. So the ambulatory treatment unit has, usually we weigh the patient since the medications is based on the height and the weight. So a fellow in training usually assess the patient upon entry in the ambulatory treatment unit. We ask the patient how they are within the past weeks. So if they have any infection, automatically they will not receive any chemotherapy because chemotherapy would further would further compromise the infection. So first, we assess the patient holistically. So if there are any diarrhea, any chest pain, or any other complaints that has not been addressed prior, we usually address them first. If the patient has no, or asymptomatic has no further complaint with the set labs that are unremarkable, so we subject them with the chemotherapy. Usually, there are sets of pre-medication first, and then afterwards, we infuse via the IV, then we observe the patient. Usually, the infusion would take about 2 to 3 hours. Then the pharmacy would calculate or would mix the chemotherapy and the dose, the appropriate dose that we've computed. Then accordingly, it will be infused in the ambulatory treatment unit. During the infusion, we observe them. Any form of adverse reaction, hypersensitivity, reaction, hypertension, hypotension, desaturation, any complaints, rashes, hypersensitivity, we take note of them. And then even post-medication, we observe them for about 30 or 1 hour. Then if it's well, we scheduled accordingly the next set of laboratory and the next cycle. So usually before, during, and after the infusion of the chemotherapy, we assess the patient because it's important to take note everything that's going on with the patient during the infusion.
Oh, thank you so much for sharing with us the process and how you conduct these treatments. And we are really assured that the patients here in the Benavides Cancer Institute are in good hands. So thank you so much for that.
Thank you. Thank you.
And now we are here with Mr. Baluyot, one of the chemotherapy patients here in USTH. So, Mr. Baluyot, good morning po. Morning po. So, nakakailang chemotherapy sessions na po ba kayo dito? And kumusta naman po kayo?
Okay naman po. Ayos naman po yung pagkakaano sa akin ng treatment ng gamutan. May marami namang nagbago. Simula nung nakaramdam ako ng mga symptoms sa cancer. Nung nagka-treatment na po, malaki na po pinagbago. Yun lang.
Maraming salamat po sa pag-share niyan sa akin.
Opo. Thank you rin po.
Po. Treating head and neck cancer or any other disease requires a substantial treatment plan. This ensures that every patient receives the best possible outcome for their health condition. But treatment shouldn't be the last step in the long and winding road of recovery. No, that topic will be discussed in our next episode. My name is Chelsea Rushana, your host for Lifeline, where we improve our lives by feeding our minds.